Hello, welcome to another edition of Let's Learn Together. Our topic today is obesity and your health. First of all, let's start with what obesity is. Obesity is simply weight above what is considered healthy, and it's often measured using body mass index. And obesity is a serious medical condition that can cause several complications such as metabolic syndrome, high blood pressure, atherosclerosis, diabetes mellitus, high blood cholesterol, some form of cancers, and sleep disorders. Before we go ahead, let's quickly get to know what BMI is all about. The BMI is the recommended tool for assessing obesity, and BMI is a person's weight in kilograms divided by the square of a person's height in meters. The normal range for BMI is within 18.5 to less than 25. This is considered the normal range. But if a person's BMI is within the range of 25 to less than 30, this person is considered to be within the overweight range. But if a person's BMI is above 30, this is the obese range. On this note, I want to quickly run down the three forms of obesity. We have three forms of obesity. Class 1 obesity, also known as low-risk obesity. Low-risk obesity is when a person's BMI is within 30 to less than 35. In Class 2 obesity, this is also called moderate risk obesity. And at this range, we are having a BMI that is between 35 to 39.9. And lastly, the high risk obesity, also called class 3 obesity. This is when a person's BMI is equals to 40 and above. Having known what obesity is and also knowing the types of obesity, let's discuss or have a review of the causes of obesity. We have several things that could lead to obesity, which are physical inactivity, overeating, genetic factor, intake of diets high in simple sugar or simple carbohydrates. We also have some that is caused by psychological factors. Diseases too, such as polycystic ovarian syndrome, insulin resistance, hypothyroidism, Cushing's syndrome can also predispose an individual to obesity. We move ahead now to the warning signs that indicate a person is obese, or you can call it signs and symptoms of obesity. They include shortness of breath, joint pains. The person will have risks of hypertension, depression, skin problems, heartburn. The person will also have some forms of sleep disorders like snoring. Let's have a look at how obesity affects one's health. We start with risks of stroke. Obesity can lead to high blood pressure, which is the leading cause of stroke. A person who is obese has increased risk of heart attack. High blood pressure, cholesterol, and body sugar can harden a person's arteries and increase the person's risk of heart attack. Also, liver disease. Excess fat can build up around a person's liver, leading to damage and even liver failure. Then some forms of cancer. Obesity has been associated with cancers like liver, kidney cancer, colon cancer, and pancreatic cancer, among others. How about gallbladder problems? Obesity raises a person's risk of gallstones, which may require surgery. Also, obesity can make a person's body resistant to insulin and lead to high blood sugar, increasing the person's risk of type 2 diabetes. An obese person is likely going to have muscle mass reduced and bone density deterioration, leading to disability and sometimes fracture risk. Obesity can also affect a person's mental health, including a higher risk of depression and issues with body image. How about sleep apnea? People who are obese it's likely that obese patients or obese individuals, because of the buildup of fat tissues, this buildup of fat tissues suppresses their airway and narrows it to be too small, and this will lead to breathing problems. It will surprise you that obesity too has been linked to gastroesophageal reflux disease. Obesity has been associated with a higher risk of GERD, where stomach acid leak into a person's esophagus. Kidney failure too has been proven to be as a result of obesity. Other complications of obesity like diabetes mellitus and high blood pressure can lead to chronic kidney disease. Wow, this one is great. Infertility. Obesity can make it more difficult for a woman to get pregnant, as well as increase the woman's risk of pregnancy complications. And lastly, as one of the ways by which obesity affects the body is joint pain. Excess weight puts pressure and strains the joints, causing pain and stiffness. Most people feel that because they are obese, that it cannot be treated. But I want to tell you today that obesity has a treatment. There are three main approaches in the treatment of obesity. 1, self-care. 2, lifestyle drug. 3, behavioral therapy. And we also have surgery too. Surgeries too can be done to treat obesity. In self-care, the mainstay of treatment is lifestyle changes such as diet and exercise. While in lifestyle drug, physical exercise, weight loss, consumption of low carbohydrate diets and low fat diets also helps in the treatment of obesity. Physical exercise, this is when an individual is involved in aerobic activities, that's activities that increases heart rates. And by doing this, it increases the person's heart rate, and the individual should be involved in at least 20 to 30 minutes of exercise at least 5 times in a week, because this has proven to improve cardiovascular health. Weight loss too can help improve obesity and reduce risks of complication. And also, surgery can also be done to help in the treatment of obesity. Thank you very much. Feel free to drop us any question if you have any. Thank you very much once again. Keep a date with us.